Thank you for putting this beautiful All Things Senior virtual meeting together. As you all know, these are trying times, and we are all trying to do our best to really make sure that you all have what the information that you need to make a well-informed decision. So again, my name is Eva Mendez. Thank you so much for joining and expressing interest in learning more about Alignment Health Plan. Just to give you a brief overview of what we will be covering, we're definitely going to be covering the information about Medicare, the open enrollment periods, what you can and cannot do, and then we'll jump right into the benefits for Alignment Health Plan. But as you know, this is the open enrollment period, which started October 15, and it's going to run all the way through December 7. So keep in mind, this is the opportunity that you all have to make a well-informed decision. Now, after all, you paid into the Medicare system. So what you want to do is you want to shop for the plan that's going to give you the best for your Medicare dollars. Now, aside from the annual enrollment period, again, which started October 15 and it's going to run through December 7, there is also what we refer to as the open enrollment period. Now, this period is also very important for you to be aware of and what it means to you. So if you are already a Medicare Advantage plan member, you may disenroll from the current plan and switch to a different Medicare Advantage plan one time during the period of January 1st through March 31st. So what that means to you is if you make an election during your annual election period, AEP, October 15th through December 7th, and for some reason you're just not happy with what you chose or it's just not what you were thinking of or looking for, you have one more opportunity to make that change. So really it gives you a great opportunity to try out something new. And if it's something that you thought wasn't going to be, you can either always go back or you can actually make a change to a like plan. You also have the opportunity to cancel everything altogether and revert back to original Medicare and choose a prescription drug plan. Now, once those two periods are over, we now have a special enrollment period throughout the entire year. So depending on certain circumstances, you may be able to enroll in a Medicare plan outside of the initial enrollment or the annual enrollment timeframes. So some ways you may qualify for a special enrollment period is if you retire, right? And you lose your employer coverage. Maybe you move in or out of the service area. If you receive assistance from the state, like if you have low income subsidy or if you have Medi-Cal, or if you have been diagnosed with a certain qualifying disabilities or chronic health conditions. Now, there are some plans that have a special plan, a special needs plan that you may enroll in if you qualify due to a specific chronic health condition. Again, if you qualify for extra help, and what that means is the assistance from the state and managed through the state, offered through the federal government, and it really helps you with your prescription coverage. So this is, again, during any time after April 1st, all the way through the end of the year until open enrollment starts all over again. Now, what do you need? What happens when you have Medicare? What are your choices, right? What are your Medicare choices? So after you enroll in original Medicare, which you are then given your Part A and your Part B, there are two ways to get additional coverage, right? So you can either, number one, you can either stay with original Medicare. That's your first option. Second is looking for a Medicare supplement insurance. You can either do that and also add a prescription coverage, or you can choose a Medicare Advantage plan, which what we refer to is the Plan C. It actually combines your Part A and your Part B, which is your medical and your hospital coverage. And then it also tags in that Part D for prescriptions. And bundled up together, it is what we refer to as your Part C, or also known as your Medicare Advantage plan. Now, when you choose the route to choose a Medicare Advantage plan, and by the way, that is what Alignment Health Plan is, you do have some advantages, and those advantages can include the embedded prescription drug plan coverage, annual physical and screenings, worldwide emergency coverage, and out-of-pocket spending limits. So these are the things that original Medicare does not offer with just Medicare Part A and Part B. Now, Medicare Advantage plans for those with special needs. So we talked about those members there is a specialized Medicare Advantage plan that is called, again, a special needs plan. So these plans include focus and specialized health care coverage for specific groups. So the first one would be someone who is dually eligible if they have both Medicare Part A and Part B. If they also have a chronic condition, there is some plans that have specific plans that have those members that have those ongoing chronic conditions such as diabetes or cardiovascular disorders or heart condition. Or if a member is institutionalized, for those members living in a nursing home. Now, when we talk about the prescription drug coverage, again, you can purchase this separate by just having Medicare and purchasing a separate Part D plan. But if you're looking to have everything all bundled up together, as I mentioned, the Part C, a Medicare Advantage plan, it includes that prescription drug coverage. So a couple of things that we want to define, and what is, for example, step therapy. So one way that Alignment Health Plan helps you save money on your prescriptions is by offering the lower cost drugs that can treat the same medical conditions as a current brand name drugs. You may be asked to try one or more of these lower cost drugs before the plan will cover the brand name drugs that you are currently taking. So it basically just means that we have a set formulary. If there is a medication that is not on that formulary, but your doctor feels that you need it, we will then have you try the covered medications. And if that's not a good option, then we will then take the next step and honor that medication. So again, just to kind of define what step therapy means. Quantity limits. So as you know, some drugs do have quantity limits where the plan will cover only a certain amount of drugs for one copayment or over a certain number of days. So the limits may be in place to ensure safe and effective use of the drug. So again, there is reason to the madness. If your doctor prescribes more or thinks that there is a limit that is right for your situation, then your doctor will be asked to then add that additional quality and just kind of let us know the reasons why. Again, it's just for your safety as we have these quantity limits. Prior authorization, let's go ahead and just define that. So before the plan will cover certain drugs, it may need more, we may need more information for your doctor to make sure that the drugs is being used correctly for medical conditions covered by Medicare. You may be required to try a different drug before the plan will cover that prescribed drug. So again, it goes back to very similar to the step therapy. If there's a particular medication that your doctor is absolutely wanting you to take and it's not traditionally in our formulary with prior authorization and again, the correct documentation, we then can proceed with giving you that authorization for particular medications. Now, again, we covered what Medicare will offer you and what it takes in order to join an alignment or to join a Medicare Advantage plan. So let's go ahead and talk about why should someone choose alignment, right? So for some of you, you've maybe never heard of us. You maybe are curious to say, well, what is alignment? What can they bring to the table? Why would I switch to alignment? So let me just kind of tell you a little bit about our organization. Since inception, which is now going on 6 years, we have managed to jump from a 3 to a 4-star Medicare overall rating. We've been awarded 5 stars for our Part D plan, so that speaks volumes on our prescription coverage. We do rank 90% in the CMS Medicare in You book. So what that means is that if you look at your CMS Medicare in You book, we're right up there, 90% ranking, and it's really ties to the service that we provide to our members and the value of our benefits. We are homegrown here in California. Our corporate office is in the city of Orange in Orange County. We do have over $900 million in revenue. And really what this means to you is an organization that is very financially stable. We do have over 700 plus employees, and we continue to grow within our organization. And again, these are the folks that are there to help not only our members to but support our doctors and our partners as well. We have been awarded a 65 net promoter score. So what that means is that there is a third party company that we work with to survey our own members, really all around the level of care that we're providing. So we've scored 65. The average Medicare plan has scores about 33, and Amazon, and you know they're all about the level of care, and I'm sorry, the level of service that they provide, they score at 68. So again, this just speaks volumes of where we are at when it comes to servicing our members. We're really big on that. We do have over 70,000 members, and we continue to grow and expand. We are in 20 markets across 3 states moving into 2021. And one of the reasons that we're able to do it is the next generation technology with the right human touch. So really what we do behind the scenes really helps us better manage our members' care. And I'll talk about what our capabilities are. But by having this technology to really support our members, we are then able to lower the hospital admits per thousand, which is very, very important to you. Now, if you're looking at 1,000 members or 1,000 Medicare recipients, and out of that 1,000, we are able to have a very low admit per thousand, ranging between 150 to 160, where the average Medicare Advantage plan ranges between 190 to 200 or 210. So it just speaks volumes that what we're doing behind the scenes, offering our members a lot of preventative measures, really helps us to identify certain areas where we're able to then lower the hospital admits. As you all know, no one likes to be in the hospital. I certainly don't. So we do our very best to keep you out of the hospital and on that healthy path. Now, as I mentioned, one of the ways that we do it is our technology. So what we have, it's our advanced technology. It's been created by Alignment. It's an application. And basically it's an application where the doctors can see the information, all of our members' information, to help make better decisions around our members' care. So again, it's a lot of that goes into what we refer to as our command center. She now has a name, it's AVA. So look at it as a platform where all of this information goes in. And again, it's really the brains behind Alignment Health Plan. So just to kind of break it down, what it actually does, as I mentioned, it is our proprietary platform. In other words, we own this software. No other health plan has these particular capabilities. It actually predicts, monitors, and tracks the changes in our members' health status, and also in the ways that they're using their health care. It has over 200 unique types of data, which is refreshed every 15 minutes. So things such as your current acute care census, or HEDIS star quality measures, or clinical alerts. But the most important is a patient 360 view. So in other words, the command center will give your doctor patient 360 view that's refreshed every 15 minutes, whereas other carriers, they have similar platforms, but it's only refreshed every 24 hours. So again, with this information, it actually generates over 500,000 proprietary algorithms that generate over 5,000 automated alerts. So what these alerts and algorithms do is they actually enable our case management, our nurses, together with our field clinicians, to perform automated daily rounds and act on predictions about our members' needs. So again, this information that we gather, we input it into our command center, and it better helps us manage our members' care, and of course, predict of anything that may potentially happen. Now, the second secret sauce to Alignment Health Plan is this beautiful black card. Every single Alignment member receives on-demand concierge service. So let's talk about what this little black card does for our members. First, it actually gives our members access to Alignment Health Plan 24/7 concierge care. So if you have a question in regards scheduling transportation, or what gym do I go to, or how can I access my pet care benefit or dental, vision, pest control, or I would like to connect with a virtual doctor, there is one phone number for you to call on the back of this beautiful black card. So again, it is available to you 24/7. Now, the second feature to this card is by flipping it over, you'll notice that there's a test strip. I'm sorry, there is a credit strip right on the card. And the second feature to that is that you're going to be able to go shopping. Every single plan has an amount of over-the-counter allowance that is uploaded onto this black card. So what do? You're going to go to our contracting retail stores such as CVS, Walmart, Walgreens, Dollar General, Family Dollar, Rite Aid. You're going to go shopping at any of these local retail stores. You're going to then choose over-the-counter products, and you're going to pay by swiping this card as if it were a credit card or a debit card. Now, in some plans, we even add an additional grocery allowance for those members that qualify due to a certain chronic condition. So you have an additional grocery allowance, and it works the same way. We upload it onto the black card. You go shopping for groceries, you swipe the card, and that's how you pay. Now, every single member will also earn wellness reward credits or dollars, if you will. So the way it works that if you complete a wellness activity, for example, you get your flu shot, or you complete your physical, your yearly physical, or your mammogram, any type of wellness activity, we reward you by doing a great job, and we also upload a dollar amount onto the black card. Now, and then you go shopping and you purchase items under these particular categories. So because of the COVID-19, of course, right now, it's now more than ever, it's very important for you to stay safe, stay at home if all possible. So what we've done is we've actually partnered with Nations OTC. So if you would like to order your over-the-counter products online or by calling Nations OTC, we also give you that option as well. So you don't technically have to go to the retail stores to utilize your benefit. Now, there are some very exciting supplemental benefits that we're embedding into our core plans. So I'm going to go ahead and share with you with what those are. When we talk about pet care, this is a brand new benefit for 2021. This benefit will provide pet boarding for members who have hospital procedures or emergencies or need pet care while they're away. The standard benefit is for 7 boarding days or 14 walks. And again, this is based on a specific chronic condition. Pest control is also brand new for 2020. This benefit assists members once per year with pest eradications to ensure the health, welfare, and safety of the member. It's also, again, tied to that specific chronic conditions. We are also rolling out the Personal Emergency Response System. It's the PERS for new for 2021. So the PERS device allows members who live alone or they are at risk to fall, or they're able to call for assistance with just a push of a button. And also we are rolling out a brand new acupuncture and chiropractic benefit. So we've added this acupuncture and chiropractic service as a supplemental benefit for 2021. The benefit allows the members to visit network chiropractors for pain relief, neuromuscular skeletal disorders, and of course, nausea. The benefit does not require authorization or referrals, and you will have anywhere between 12 and 24 visits a year at a zero cost. Again, you do not need a referral, you do not need authorization, and the network that we are working with is called American Specialty Health. Now, we continue to offer the over-the-counter allowances that is available, that is uploaded onto your black card, as I mentioned in the previous slide. Same thing with the grocery benefit. That one is also tied to a specific chronic condition qualifier. And then we are also going to continue to offer companion care. So we continue to offer companion care to eligible members that have feelings of loneliness and isolation. As you all know, this can be very detrimental to one's health. So we are connecting college students with a company that we work with, Papa Pal, to members who need assistance with even something as non-medical services, such as light house chores, technology lessons, and general companionship. The benefit covers 12 hours per quarter, 48 hours a year. And again, it is tied to a social determinant, meaning there has to be a qualifier in order to activate this benefit. We are also rolling out brand new to 2021 an optional enhanced dental plan. You basically will have an additional premium of 22.72 a month, and what it does, it gives you a dental maximum of $1,500. So right now, the way the benefit is that everyone has an embedded dental plan. You don't pay for our dental plan now. And what it does, it gives you preventative and comprehensive coverage, more like of a discount between 30 to 45%. This is something optional, which will enhance your copayment amounts, which will actually lower your copayment amounts with a dental maximum. The vendor that we use is Liberty Dental, and they've also expanded their network moving into 2021. So this is something extra that you can add on to your plan. We will continue to offer a fitness membership across the board with every single plan that we offer for our members. We do use PeerFit Move. And really the way it works is you have 24 credit, like a 24 credit allotment every single month. So you can do a number of things with these credits. The first thing you can do is you can go ahead and use 14 credits to maybe choose your local traditional gym like LA Fitness, 24-hour fitness, and so forth. With the remainder credits, you can actually purchase specialty classes such as Zumba, yoga, kickboxing. All you need to do is just call our concierge team and then they'll go ahead and help you with those benefits. We are also rolling out a brand new all virtual plan. This is the very first in the industry. So for those of you that are looking to really receive your care from the convenience of your home, we heard you, we did it. We are now rolling out this virtual plan. It's called AVA. This particular plan is available in LA and OC. What it does, it gives you access to a virtual concierge provider, and you get to choose from a limited number of providers that we have. It doesn't cost you anything for any virtual appointments. If you will also have your 24/7 virtual care team. We will also give you a $100 per month OTC credit. We will also help you with a $50 Part B premium give back. So depending on how the members receive their Part B premium, the members can receive a $50 increase in their Social Security check or credit towards their Part B premium statement. So again, this is a great option for you to consider if you would like to receive your care virtually. Now, when we talk about that $100 OTC allowance, you can do a couple of things with it. Number one, you can, again, go to the retail stores, just like we talked about, and purchase your over-the-counter products. Or if you would like to use your $100 monthly allowance, you can actually purchase Apple products and cellular plans with your allowance. So the members can also use their OTC allowance to purchase an Apple iPad, Apple Watch, and or monthly cellular plans. So once it's purchased, those Apple products are yours to keep. So the members will contact their virtual care team to initiate the redemption. Upon confirmation, the monthly allowance will be withheld for the full duration before the items are shipped to the member's home. So in other words, let's just say you want this beautiful Apple Watch, right? So what you're going to do is you're going to call your virtual care team. You're going to initiate your request. You're going to say, I would like this Apple iWatch. They're going to say, okay, it's going to cost you 3 or 4 or even 5. I'm not really sure the months of your OTC allowance. So they're going to withhold those months. And once that time has, elapsed, then we're going to go ahead and mail you that Apple iWatch, and it's yours to keep. So this is just a great way for you to really take advantage of your over the $100 monthly OTC allowance. Or you can actually purchase monthly cellular data up to $30 of your $100 monthly. And it is through T-Mobile. So if you're using T-Mobile, this is a great option for you as well. So again, consider this AVA brand new all virtual plan. It also includes like the dental, vision, bonus drugs, companion care, pet sitting, groceries, all embedded. So it really is very rich in benefits. We also will continue to offer these insulins, Humulin R and 7030, under a very low tier 1, which is a zero copayment. So for those that are asking, do you cover insulin at a zero cost and it is covered through the donut hole? The answer is yes. It is the Humulin and it's the vial form. We also use Freestyle as our diabetic, for your diabetic supplies. This is the brand that we cover. We are also rolling out the bonus drugs. So if you are needing these drugs that are typically not covered by Medicare, for example, the generic form of Viagra, cough and cold medications, certain prescription vitamins, or weight loss or hair loss medications, you actually will be able to get these medications with Alignment Health Plan. Now, when we talk about the product offerings, we have 4 plans that you can choose from. So depending on where you are at, this is what your options are. So we have our typical, our very traditional core plan, which is the Platinum. The highlight on this plan is that you have a very low maximum out of pocket, zero co-payments for doctor, specialist, hospital, skilled nursing, urgent care, lab x-rays. You don't pay anything for that. Ambulance and emergency room, $50. We waive it if you're admitted. We are adding again that acupuncture and chiropractic benefit, diabetic supplies at a zero cost, shoes and inserts, 20%. We are adding that comprehensive dental buy-up option, vision, it's $300 every year. We are also adding transportation, a hearing allowance of $1,000. OTC for the groceries is 40. I'm sorry, OTC allowance is 40, groceries is 20, companion care, pest control, and pet care. And very low co-payments, 0 for tier 1, $3 for tier 2, 30 for tier 3, 75 for tier 4, 33% for tier 5, and $5 for tier 6. We also have a heart and diabetes plan. This is a plan that's available all year around. So if you have a heart condition or diabetes, this is a plan that you might want to consider. Highlights on this plan is the lower maximum out of pocket to $1,000. Diabetic supplies is 0, shoes and inserts is 0. You also have the OTC, pet care, and the personal emergency response. We talked about the AVA plan, all of the rich benefits that are available under our brand new virtual plan. And for those members that are dually eligible, we do have a Cal Plus plan. This is a Medi lookalike. So if you have Medicare and Medi-Cal, this might be a great option for you. The highlights on this plan is that you do have a chiropractic and acupuncture benefit. We do have a dental quarterly allowance of $300. And then of course, vision is $500 every year. I'm sorry, every 2 years. We are adding again the $100 OTC allowance, groceries, $20, companion care, and the personal emergency response system. Now, because this plan is for someone that has low income subsidy and Medi-Cal, their co-payments for prescriptions would be determined on their LIS level. So this basically concludes my benefits that we have to, or our benefits that we have to offer for you. If you have any additional questions or you would like to set up an appointment, please be sure to reach out to Alicia Magana, who is also another local Alignment Health Plan representative. And this is her phone number, 657 area code 236-1923. I'll go ahead and open it up to any questions. I believe we only have half an hour, so I want to be respectful of the time frame. Any questions at this time that I can answer for you?